Athletes, listen up. Well over 200,000 concussions in children are sports related. Dr. Karen Sutton is an orthopedic surgeon at Yale New Haven Hospital, specializing in women's sports medicine. Now, she's here to tell us what to do if your child has a traumatic brain injury. Welcome, Dr. Sutton.
Thank you very much, Jocelyn.
Why does it seem, anyway, it appears to us that we're hearing more and more about concussions? Is it more common?
I think it's not only more common as more children and adolescents are playing sports, but also there's a new push to study concussions and to learn the effects of concussions. So when we're talking to some of the NFL players, as they get past their careers and later in life, they're starting to have early dementia and sometimes Parkinson's symptoms. So now there's some research being done that NFL players have donated their body to science following them passing away, and that we can analyze their brain. And then we're seeing a lot more damage than we thought initially occurred if they've had concussions throughout their life.
And this is a study that's really looking at long-term effects of repeated concussions.
Exactly. So a lot of these professional players that have had multiple pretty severe concussions and are starting to notice some symptoms down the road, that's what they're looking at.
Now, are children more vulnerable to concussions?
So children are more vulnerable. They've looked at children and they seem to have a longer recovery period that occurs following concussions or following this type of injury to their brain. So we like to be a little bit more cautious in children who have suffered a concussion.
What are some of the symptoms or warnings that parents really need to look for?
So one thing that's a myth is that there's always a loss of consciousness involved with a concussion. So if you look at the person like, oh, they didn't lose consciousness, they're totally fine, that's a myth. You look at if they're staggering a little bit, if their reaction time doesn't seem to be the usual. Sometimes even the next day or the day after, they might even start to develop a depression or changes in their mood, either a depression or slightly more anxious. So you really have to be aware of these little cues following an injury that may have occurred.
Now, what about memory loss?
Memory loss, that's been studied as well, and they've also looked at retrograde amnesia, so amnesia before the event, but now they're also looking at amnesia following the injury. So if you're sitting with the athlete after they had their injury, can they recite what happened during the injury? Do they remember walking off the field? Do they remember who they talked to right afterwards? So asking these probing questions can certainly help to decide if the athlete suffered a concussion.
Now, should parents give some sort of medication before they see a doctor if their child is complaining about a headache? Let's say that they want an aspirin or ibuprofen.
So typically not. We would love for the athlete to be evaluated by the healthcare profession before they've taken any medication. And also aspirin can sometimes thin the blood. So if for some reason there's been something even more significant than a concussion, like a more moderate traumatic brain injury where we might see some bleeding on a CAT scan, aspirin is very detrimental to the treatment in something like that.
Now, is football the sport that accounts for most of the concussion?
Football certainly does, but then actually cycling, soccer injuries on the playground can even cause concussions as well. So overall, if the child falls from the monkey bars and hit their head, you still want to be aware, did that child suffer a concussion after this occurred?
So let's talk about the 4-step heads-up action plan that we want to share with everybody at home. The first one is remove the athlete from play if you suspect a child of having a concussion. You say, when in doubt, sit them out.
Exactly. So we want parents and coaches to have a very low threshold to say, look, let's just check out this athlete a little bit more on the sidelines. Let's get them in a controlled setting where we can ask them these questions. And there are certain cards that you can even carry on the field, which you can ask these athletes certain questions and see how quickly they respond to them. So we just want to take a little bit more time to analyze these athletes as they come off the field.
Absolutely. We were talking about a new program that coaches really have to implement this year, or recently anyway.
Yeah, it's great. Connecticut High School is now one of the few states that actually requires training for high school coaches in concussion management. So that's a huge benefit now to our school system.
Excellent. Now, the second one is you say ensure that the athlete is evaluated by a healthcare professional experienced in evaluating concussions.
Exactly.
So you shouldn't really go to your primary care. You need to go to somebody who specializes in it?
Well, I think that works twofold. I think once they're on the field, I think it's great to have the coach evaluate the player or an athletic trainer evaluate the player, somebody who is more versed in concussion management. So there's both the immediate risk assessment and then the risk assessment that can occur the next day. With, if a pediatrician is trained in concussion management, that's fine, or they can see an orthopedic surgeon, neurologist, neurosurgeon, somebody who's trained in concussion management.
All right, the third one is inform the athletes' parents or guardians about the possible concussion and give them the fact sheet on concussion. We were talking about that earlier.
Correct. I think parents and coaches, they're the main line of treating their children, and so we'd love for them to be more involved with their care for concussions. So like I mentioned, if the child seems to be having some mood changes, if they can't concentrate as well, a new push is to actually now take these children out of class for a few days until they really start feeling more comfortable, because we want to give them an overall brain rest. So not just rest from sports, but to rest their brain as well. So they shouldn't really be playing video games. Maybe they shouldn't be in school really concentrating extremely hard as they recover from this concussion.
We really need to listen to our student athlete.
That's correct.
Right,
Yeah.
and observe.
Exactly.
And the fourth one is you say keep the athlete out of play the day of the injury and until a healthcare professional experienced in evaluating concussions says they're okay to return to play. They really need to get that okay.
Typically, it actually takes between 7 and 10 days for an adolescent or a child to recover from a concussion. So we have kind of a step-by-step plan where they slowly, again, remove themselves from some of their school activities and sporting activities. And it's a range from allowing them to start some conditioning to some drills, slowly involving contact again, slowly involving contact-related drills, and then finally back to a game setting. But it can take about 7 to 10 days to get them back to a game.
What can be done to prevent concussions? I mean, some of these are accidents, obviously. Well, most of them are they not?
Most of them are accidents, we hope.
Yeah.
But in Connecticut now, having the high school coaches involved a lot more with managing concussions, that's one way to, not that it specifically prevents concussions, but it's going to prevent any more ramifications after concussions. The other thing is having appropriate equipment during games. So in a football game, wearing both a mouth guard and a helmet, because the mouth guard actually helps to absorb some of that shock of the hits, as well as in lacrosse. Boys are wearing helmets, girls are wearing mouth guards. Basketball, same thing. The boys are wearing mouth guards for basketball. So certainly having appropriate equipment can help a lot with this.
All right, and we want to give a special shout out to SportsWorks for bringing us this topic and all of our parents of athletes topics every week. Dr. Sutton, thank you again for being here.
Thank you, Jocelyn.
Great